Good afternoon, friends. I'm Dr. Ajay Shah, bringing this another afternoon live. And today's topic is actually a repeat of the topic I did last week. Last week, I did a talk on how to prevent depression naturally. That was a very long talk. So, with a popular demand, I'm going to make this talk about 30 to 30, 40 minutes long. So, this topic is about how to prevent depression and how to prevent relapse without any medications. Uh, so please share on your page. This will be a twice a month seminar. It's going to be about 30 to 40 minutes long. It will be packed with a lot of different tips. So if you have any questions, please go ahead and ask the questions. I'll answer every question. And I can pretty much assure you that if you watch this seminar, you will be able to prevent depression and prevent the relapse almost 90% certainty. So I have suffered myself depression 10 years ago. I suffered from a major depression, and actually I suffered many consequences. So I don't want any of you to follow, you know, any of the complications of depression and prevent depression and prevent definitely the relapse of depression. So how do you diagnose depression? If you have any of the following symptoms for 2 weeks in a row, and many symptoms are actually about weight loss or weight gain, sleep disturbances, psychomotor retardation or agitation, fatigue and low energy, worthlessness, guilt, loss of concentration, and particularly if you have suicidal thoughts. If you have those thoughts for 2 weeks, that means you possibly are suffering from depression. Many times, you actually will need to see your primary care physician or a psychiatrist if you feel like you are suffering from depression. So watch out for those symptoms, particularly if you have those symptoms for 2 or more weeks. Depression can be classified into unipolar depression, where only the depression happens, or a bipolar depression, where mania or hyperactivity also happens. Make sure you have a proper diagnosis, because people who have bipolar depression, if certain antidepressant medications are given, thinking that depression will be helped, it can exacerbate actually manic episodes. And your primary care needs to be very careful before prescribing antidepressant, particularly if you think you are suffering from bipolar depression. So make sure you talk to your primary care if you feel that you have any symptoms of hypomania or mania. So how common is depression? Depression is as much as 25% of US population, possibly even more. It's almost as common as obesity, actually. And if someone is 10 years old, developing depression has almost 50% lifetime risk. So very, very common depression. Depression actually is a lifelong illness. Once one episode of depression happens, once one episode of depression happens, second, third, and subsequent episodes become very common. So again, it's a lifelong illness, just like any other chronic illness, like diabetes, high blood pressure, dementia, heart disease, and many other chronic illness. So key thing is to prevent the first episode, and the methods I'm going to show you actually will prevent the first episode. Um, so what are the causes of depression? Family history is number one important. If you have family history of depression, make sure you watch out to prevent first episode and also prevent subsequent episodes. A traumatic life event like going through divorce, losing a job, losing a loved one with death, those things also can precipitate depression. Childbirth is very, very common reason for postpartum depression. Childhood neglect is also common reason for depression. Obsessive compulsive disorder is also a common reason for depression. People who are in isolation, who are lonely, people who live a single life are also at risk of developing depression. Alcohol abuse and substance abuse is also a very common cause for depression. So prevent and avoid as much as you can with alcohol and substance abuse. And any kind of physical illness, like chronic illness like diabetes, high blood pressure, heart disease, cancer, autoimmune disease, also predispose you at the risk of developing depression. So these are some of the common causes of depression. Many times depression happens because of endogenous hormonal imbalance, particularly with serotonin and dopamine. So you may have depression without any apparent cause also. Whenever you listen to my lecture, make sure you're making all the changes in your medications under supervision. Many times medications are necessary, but the methods I'm going to show you are almost as equal to taking a medication or even better. Unfortunately, even on medication, there is a 50% chance of relapse after the first episode of depression. And after two episodes of depression, there's an 80% chance of relapse. Like I said, depression is a lifelong illness. So if you have one episode of depression, you should watch out to make sure second, third, and subsequent episodes don't happen. Matter of fact, it's proven that people who have more than 3 or 4 episodes of depression in their life, their depression episodes become very frequent. They develop depression every few months, and sometimes it's hard to come out of depression. After each depression episode, the duration between the two episodes gets shorter and shorter, and you almost feel like you are going in and out of the depression every few months. Medications have many side effects, so the methods I'm going to show you actually can be without side effect and may have actually good effects on your health, on your physical health. So again, in between relapse of depression, you will feel good. You will have a normal life. That's when I want you to follow the methods I'm going to show you. If you follow those methods while you're feeling good, it will be easy. It will become habit. And if you do it on a consistent base, then it will be much more effective in preventing the relapse. Again, in between the episodes of depression, you'll be feeling normal, you'll be feeling good. That's when I want you to do all these techniques and methods to prevent the subsequent episodes of depression. But what I'm going to show you has no cost to it. It's very effective, actually highly effective, and it's evidence-based. It's very science-based, and everything has a proven track record in terms of preventing the relapse of depression. So what I'm going to show you, as you watch, make a list and read the list every day. If you're truly suffering from depression, watch this video. It will be on YouTube at least once a week, and employ as many techniques as you can to prevent the relapse of depression. If you're having any suicidal thought, please call your primary care physician, call 911 if necessary, or call suicide hotline. Suicide rate has gone up in America, and I definitely want you to take, if you are having any suicidal thoughts, very seriously. So call 911, call your doctor, or reach out if you are having any suicidal thoughts. Number one, know and believe that depression is never your fault. Depression happens many times for various reasons, but it's never your fault. Obviously, certain lifestyle actually will predispose you to having depression, but it actually technically is never your fault. Also, when you have a depression, always use the language that I have depression or I am experiencing depression. Never use the language that I am depressed. Just like when people have cancer, they don't say I am cancer. They always say I have cancer or I'm suffering from cancer. They never say I am cancer. Same way, never say I am depressed, because you are different than what you are going through. You are different than what you are experiencing. You are a unique individual, and you should never say I am depressed. Always say I have depression or I'm experiencing symptoms of depression. So let's start those methods. I will be going very fast, so please listen to it carefully. Please take notes. Please watch it again and again. Number one thing I want you to do is exercise. Exercise for 1 hour. Exercise is as good as medication. You must raise your heart rate if you want to have benefits of exercise on depression. Do it every day, and I want you to also move every hour. Also track your exercise with a Fitbit type device. I exercise every day to prevent relapse of my depression. Second thing, very important, is sleep. Sleep 8 to 9 hours in bed. Track your sleep. Go to sleep as early as possible. Watch my sleep video if you are having difficulty sleeping. Poor sleep can be a trigger for relapse of depression. Next thing is having routine. Have a morning routine and an evening routine. Morning routine can be easily exercise, meditation, planning your day, having a healthy breakfast. Evening routine can be easily exercise, meditation, some breathing exercise, some social time with spouse or with family or with friends, and journaling, reflecting. All those things can be your evening routine. So very important to have morning routine and evening routine. Next thing is stopping alcohol completely. Alcohol is a major trigger for relapse of depression. If you suffer from depression, you should avoid alcohol completely. If you have drink once in a while, I understand that. But if you drink every day, particularly a lot of drinks, then you will have very high chance of relapse of depression. So I'll cut the alcohol completely as soon as possible. Next thing is doing meditation. Try to do meditation at least 30 minutes, preferably 1 hour, but even a small amount of 5 to 10 minutes of meditation will be helpful. Also, next thing is a pranayam or breathing exercise where you can do certain kind of breathing exercise activities. I have a separate video on that. Please watch that video. Next thing is having omega 3. Omega 3 is very important. That means having flax seeds, fish oil, walnuts, other things to increase your omega 3. Lower your omega 6 level by not having too much vegetable oil and balance omega 3 to omega ratio in a proper way. Next thing is taking enough vitamin D. Maintain your vitamin D level between 40 and 70. Make sure you take your vitamin D supplement every day. Next thing is exposing yourself to sunlight every day. Sunlight every day is very important for depression. If you are living in an area where there is not enough sunlight, expose yourself to 10,000 lux artificial light, which you can buy from Amazon. Next thing is journaling every day. See how your day went, what went wrong, what went right, and why it went wrong, why it went right. Journaling and reflecting every day is very important. Next thing is maintaining a gratitude journal. I maintain my gratitude journal, matter of fact, every morning and every evening. Before even I put foot on the floor from the bed, I have my gratitudes. For example, my gratitudes are I live in America, I live in Midwest, I live in a nice suburb, I have a nice house, I have a nice job, I have a nice spouse, I have nice kids, I have a nice car. I always count my gratitudes every morning and many more gratitudes. Next thing is eating healthy, whole food, plant-based, no oil diet. Whole food, plant-based, no oil diet. Next thing is avoiding processed food as much as possible. Next thing is limiting animal products to maximum 10% of your calories. Next thing is talking about your symptoms, talking about your feelings with your spouse and with your partner. Same thing, talking about your symptoms, talking about your feeling with your family and friends who are positive friends. Discussing your feelings and discussing what you are going through, discussing your thoughts with a loved one, with a family member, with a spouse helps with preventing relapse of depression. Never be alone when you're suffering from depression. Next thing is praying every day. If you are a religious person, make sure you pray every day. Even 5 minutes of prayer every day helps to prevent the relapse of depression. If you are not a religious person, find any kind of logical saying, logical prayer which you believe in a higher cause or higher nature, and at least recite that every day. Next thing is having some kind of chant. I I'm personally not into chanting, but whenever I have done any kind of chanting in my own language, which I grew up in my childhood because my parents were very religious, has definitely helped me to feel good and prevent the relapse of depression. Next thing is preventing obesity. Obesity is one of the reasons for depression. So maintaining body mass index of 22 is very important. Next thing is preventing chronic inflammation. I have a separate video on preventing chronic inflammation. Prevent the chronic inflammation if you want to prevent the relapse of depression. Next thing is observing your breath every hour for 5 minutes. Even if you are working, take 5 minute break every 8 hours. I want you to observe your breath where you actually close your eyes or keep your eyes open and slowly let the air move through your nostril and just observe the air movement through your nostril in a deep, slow breath. And that definitely has shown to relax you and shown to prevent the relapse of depression. Next thing is avoiding sugar. Sugar can be many times trigger for depression. So avoid any kind of sugary diet. Avoid any kind of cakes and cookies and pastries and chocolates which has a high sugar content. Next thing is caffeine. One coffee in the morning, I understand that. I take a decaf coffee now. But if you have any poor sleep, avoid the caffeine completely. Caffeine should be not in too much amount because that will make you have poor sleep, will make you anxious, will make you agitated, and that can have a relapse of depression. Definitely avoiding gluten as much as possible. Next thing is seeing a therapist. Actually, having a cognitive behavior therapy is as good as taking antidepressant medicine. So make sure you find a good therapist and have a regular counseling with a good therapist. Next thing is reading a self-help books. I personally read some kind of a self-help books on happiness, on mood, on depression, on relationship, some kind of a self-help personal development book. I read at least 2 to 3 hours every week on those kind of books. Next thing is having positive emotions, and the positive emotions include love, pride, happiness, gratitude, satisfaction, awe feeling, amusement, hope, euphoria, and admiration. Try to have these positive emotions every day, at least few times a day. So try to make a habit of remembering those positive emotions. For example, love. If you have a love from your spouse, from your family, from your friends, if you have pride, pride about your work, pride about your achievements, make sure you have those positive emotions. Avoiding negative emotions is also very important, and negative emotions include fear, shame, frustration, anger, hatred, sadness, rage, annoyance, boredom, loneliness, self-pity, disgust, depression, anxiety, jealousy, resentment, grief, and envy. Again, this is a big long list, but try to avoid negative emotions every day intentionally and as much as possible. Next thing is very important topic, and that's about social media. Have a controlled use of social media. I personally urge you to delete Facebook from your phone. Go to Facebook maximum 15 minutes per day, either on your computer or on your iPad. But don't carry the phone 24/7 with a Facebook on it. I had a habit of reaching out to Facebook every 5 to 10 minutes on my phone. I deleted Facebook account from my phone, and I have gained so much time. I gained so much peace. I have gained so much relaxation since I have deleted Facebook account from my phone. As a matter of fact, I want all of you to watch a Netflix movie called Social Dilemma. Social Dilemma is a movie on Netflix which I want you to watch as soon as possible. Same with other social media, including Instagram, WhatsApp, and all social media should be no more than 15 minutes per day. Next thing is being mindful and having mindfulness. Very important to do one task on hand and not multitasking. So being mindful is very important. Next thing is not making any assumptions. Not making assumptions about health, about your job, about your relationship, and making appropriate work and appropriate actions to have good effects from those relationship health and your career. So again, not making any assumptions. Next thing is being realist. Obviously, we all have dreams, we all have goals, but always be realist so you don't have that much disappointments. uh, Next thing is no comparison. Comparison is one of the reasons people become unhappy. It's one of the very common reason for becoming unhappy, a very common reason for having stress, and very common reason for depression relapse. Next thing is sometimes we don't realize what other people go through. We feel like we are the only people who are going through depression, who are going through down phase. But let me tell you, 30% of people have some down phase in their life ongoing. So be assured that you are not the only one who's suffering from depression. Same thing with every day. Do the best you can. Do the best you can, uh, and just be satisfied with whatever every day brings you. Next thing is knowing that you are unique and you live a unique life, and be yourself. Next thing is once in a while putting yourself out of comfort zone, learning new things. Next thing is very important, and that's to volunteer. Volunteering actually helps to prevent relapse of depression. You can volunteer either in person. Even now with the COVID-19, which is difficult, you can actually volunteer on a social media. I volunteer on social media by giving this Facebook talk, by giving YouTube talk. So you can volunteer by all different ways. Next thing is doing good to others and helping someone. Also helping someone who is going through depression will also help you to come out of depression and also prevent the relapse of depression. Also, next thing is improving your spiritual health. Improving your spiritual health will help you to prevent the relapse of depression. Next thing is never getting angry. Learn how to avoid anger emotion. Anger emotion is very common for becoming unhappy, for having stress in life, and that also will cause relapse of depression. So not never getting angry is the key thing. Next thing is having to-do list and check off every day as you do the things. When you finish the check off list on a to-do list, it increases dopamine and increase it's a feel-good hormone, and it prevents the relapse of depression. Next thing is walking and sitting in the nature. Walking and sitting in the nature definitely has shown to cause the preventing the relapse of depression. Next thing is being organized, organizing your house, organizing your kitchen, organizing your car, organizing your work desk, and being staying very organized, and that will prevent relapse of depression. Next thing is adequate hydration. Very important. You drink at least 64 ounces of water and preferably up to 1 gallon of water. Next thing is daily yoga, stretches, and flexibility. Those things are much more relaxing and it will prevent the relapse of depression. Next thing is increasing parasympathetic tone. I have a separate video on parasympathetic tone, and you can watch that video and increase the parasympathetic tone. Next thing is lowering a sympathetic tone. You should not have a flight or fight response on a daily basis. It should happen no more than once or twice a year. Like for me, my last fight or flight response, I don't even remember, was probably many months, many years ago. So try to prevent those flight to flight response by becoming proactive. Next thing is eating high fiber diet. Next thing is avoiding any dairy or milk products as much as possible. Next thing is having a pen and paper at bedside. If you are suffering from insomnia or poor sleep, and if you're waking up at night with racing thoughts, keeping a pen and paper at bedside and writing it down your thoughts will have effect on getting back to the sleep and will prevent the relapse of depression. Next thing is, like I said earlier, reciting a gratitude every morning. Count your blessings every morning. Next thing is having proper financial health. That means saving money, saving at least for 6 to 12 months of reserve, because financial health is one of the major reasons for having relapse of depression. Next thing is creating a happy memory list and reading those lists at least a few times a week. Revisiting those happy memories prevent the relapse of depression. Next thing is having daily dose. I call it DOSE. That means having daily dopamine in a healthy way, not by eating unhealthy food, not by sugary meals, not by doing any drugs or alcohol, but by happy way. So learn how to increase your dopamine in a healthy way. Next thing is increasing oxytocin by having touch and hugs. Obviously, it's very difficult with COVID-19, but with your family, with your spouse, with your partner, daily hugs and touch is very important. Next thing is serotonin by proper sleep, uh, by healthy food, and taking certain supplements which can increase the serotonin. And last thing is the endorphins by increasing your heart rate by doing cardio exercise that will increase your endorphins. So again, daily dose, dopamine, oxytocin, serotonin, and endorphin increase is very important. Next thing is having a pet in the house, particularly if you are living alone, if you are single, having some kind of a live being in the house is very important. Having a pet or having even a live plant in the house is very important. Next thing is watching TV maximum 30 minutes. If you really want to prevent relapse of depression, try to invest your time into healthy activities, and watching TV mindlessly more than 30 minutes is not healthy. So limit your TV time to maximum 30 minutes. Next thing is avoiding any kind of news for minutes and hours in the evening. News is nothing but more stressful activity, and you should be avoiding news watching as much as possible. I get my news by just a 5 minute reading news on a CNN app, and that's all news I get. I don't watch any other news ever in my life. Watching news is just not the right thing to do. We don't need to watch news for 2 3 hours every evening. Next thing is seeing and visiting your childhood memories, particularly if you live in the area where you grew up. Visiting your high school, visiting your middle school, visiting your childhood friends will also prevent relapse of depression. Next thing is daily serenity prayer. Many of you have heard about serenity prayer, which is essentially saying that change what you can, not worry what you cannot, not worry about what you cannot change, and have the wisdom to know the difference. So it's very important that you know that you should be practicing serenity prayer. This comes from concept of stoicism, and you should learn also about stoicism. I have a separate video on stoicism, so watch that video on stoicism. It's on YouTube. And next thing is having daily affirmations. Daily affirmations is very important, saying I'm strong, I'm healthy, I'm hardworking, I have a good relationship, I'm kind, I'm nice, I'm honest. All those daily affirmations are very important. Again, I'm showing you the tips on how to prevent relapse or depression. I don't want you to think that all this thing needs to be done. Do as many things as possible out of this list. Next thing is having daily spices and including turmeric. Preventing chronic inflammation is very important if you want to prevent the depression or relapse of depression, and having daily spice and turmeric is very important. Next thing is very important, and that's reflecting on a daily basis, reflecting how your day went, reflecting how your week is going, reflecting how your year, and reflecting how your life is going. Reflection gives us the chance to pause and readjust our life, readjust our goals, readjust our actions, and reflection is very important. Next thing is having daily some kind of chocolate, uh, high cacao chocolate is very important. Next thing is watching a funny or movie and daily laugh. Daily laugh is very important. Next thing is watching a tragedy movie once in a while. Next thing is having lots of tea every day. Caffeine-free tea gives you a lot of phytochemicals, a lot of antioxidants, and that prevents the relapse of depression. Next thing is self-care. It's never selfish to take care of yourself, and it's never it's like investment into yourself. So self-care is very important. That all the tricks and methods I'm showing you essentially improves your own self-care, and you should be doing it every day. Next thing is knowing what triggers the depression. The common triggers include alcohol, work stress, relationship stress, poor sleep, certain food, sugar. All those things have triggers for relapsing the depression. So try to avoid those triggers as much as possible. Next thing is maintaining a mood diary. It's very important you know when your mood is down, when your mood is low. Certain food can do that, alcohol can do that, lack of exercise can do that. So try to associate and try to relate when you felt low mood, what things could have precipitated those low mood. Also, next thing is very important, and that's breaking the rumination cycle. Rumination is a major thing happening when people are depressed. I had a rumination 10 years ago where all day I was thinking about what I could have done differently. So whenever you are in the rumination cycle, distract yourself, walk away or walk outside, walk in circle, walk on treadmill, watch a funny show, watch a movie, call someone, but try to break the rumination cycle as much as possible. Next thing is no self-critique. It's important we learn from our mistakes. We don't have any regrets, but no over self-critique. Very important we are not self-critical ourselves. Also, avoiding any kind of guilt and any kind of regrets. Maintaining good self-esteem is also very important. Improving relationship, and it's very important that you come out of any kind of toxic negative relationship. Very important you come out of toxic negative relationship. That will prevent the relapse of depression. Next thing is avoiding smartphone 24/7. Take a break from smartphone at least few hours a day, particularly in the evening. I would say that after 7 or 8 p.m., put your phone away to the charge and take phone only if it's an emergency. Otherwise, stay away from your phone, stay away from those blue light emitting gadgets and devices. Next thing is doing some kind of daily hand-mind activity like cooking or cleaning or gardening or sewing or crocheting or any kind of hand-mind activity you should try to do every day. That relaxes you, that lowers the stress, and that prevents the relapse of depression. Next thing is very important, which something I do every day myself, is closing your eyes 5 to 10 minutes every hour and just observing breath in a slow and a deep way. This actually relaxes you. This prevents a lot of stress, and that prevents the relapse of depression. Next thing is very important, which is observing your thoughts as an outsider. Observe your thought as if you are a second person and actually have a role model in your mind that as you are going through the thoughts, how that person would have thought about what you are thinking. So again, observing your thoughts as a second person or as an outsider is very important. Uh, Next thing is very important that try to be with a real person in the room as much as possible. I know with COVID-19, we all go through FaceTime and Zoom calls and text messaging, but try to have some real person socialization, either with your close family, with your close friends, in a small gathering, with social distance and with mask. In person, a social relationship is also very important. Next thing is taking a magnesium supplement. We all are low on magnesium, and taking magnesium supplement will prevent the relapse of depression. Next thing is keeping hope, knowing that this depression episode will pass and you'll be feeling good. And once you feel good, you'll prevent the relapse of depression in the future. So keeping hope is also very important. Next thing is a supplement of 5-hydroxytryptophan. 5-hydroxytryptophan is the precursor of serotonin, and taking a daily 5-hydroxytryptophan under your doctor's supervision also can be helpful. Next thing is making sure you take adequate vitamin D. Uh, Next thing is practicing loving kindness meditation. This is a special kind of meditation where you actually think about a person and give him or her a proper love, proper thoughts in your mind, in your thoughts, and this is called loving kindness meditation. Next thing is ruling out any kind of medical illness, because depression can be because of many chronic illness, many health issue. For example, hypothyroid, uh, autoimmune, cancers, diabetes, even many of the chronic disease like heart disease. So make sure you have ruled out all chronic disease before you said that you have depression. Next thing is very important when you're suffering from depression, probably in between the bouts of depression, that every night you write down what you will do next day, 10 things. So that way you will have something to look forward to, something to celebrate, something to look forward for tomorrow. Next thing is having a life coach. Life coach are becoming very, very popular. Many people have life coach to guide them through the life, including career, including relationship, including financial health. So having a life coach is very important. Next thing is having health coach, personal trainer, having a good primary care physician. If you are suffering from depression, having a good psychiatrist, and even needing a good counselor. All those things are very important. Next thing is learning how to practice negative visualization. Read about negative visualization. Negative visualization essentially is a technique where you imagine as if something has gone wrong in your life, but it's all in imagination, it's all in visualization, and how you would come out of that event of something going wrong. And that's called negative visualization. Read about negative visualization and see if you can start practicing negative visualization. Next thing is helping others. Helping others and volunteering actually prevents a relapse of depression. Next thing is going for acupuncture. Acupuncture actually has also shown some benefits in preventing relapse of depression. Next thing is making sure that you take enough vitamin B12, enough folate, and enough multivitamin. Next thing is sitting down with the family and having a meal with the family every evening as much as possible. Next thing is that going to your prayer place or your worship place, either going to a church or a temple or a mosque, a synagogue. Right now, I know with COVID-19, many of those things are not happening, but many church, many temple, many mosques have Facebook Live, or many of them have Zoom meetings. Try to attend those meetings which are more religious. If you're not a religious person, attend any counseling, attend any group activity which talks about how to prevent relapse of depression. Eating daily berries is also shown to prevent the relapse of depression. Also maintaining healthy microbiome, which are the bacteria in your colon, and having a healthy microbiome. There is actually gut-brain axis. People who have healthy microbiome prevents the relapse of depression. That means eating fermented food, eating plant-based yogurt, or eating a lot of soluble fiber, eating a lot of vegetables, fruits, and beans will prevent the, 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 the unhealthy microbiome and will prevent the relapse of depression. Next thing is reading positive thinking books. Actually, there are a lot of positive thinking books. One of the books which I have read many times is Power of Positive Thinking. So read positive thinking books. The next thing is uh, having no regrets in life. Learn the lessons from your past mistakes, but never have any regrets in life. Uh, Letting go of your resentment is also very important. Next thing is forgiving. I have a separate video on how to forgive. People who forgive actually are the most beneficiary. So if you have to forgive any person, do it as soon as possible. Forgiveness is one of the most important things to prevent the relapse of depression. Also, forgetting certain event is also very important. I have a separate video on how to forgive and how to forget. Watch that video on YouTube. Also, having a life purpose. You should have a purpose every morning. You wake up, what you would do today, what you would do this week, what you would do this year, and what is your life purpose. Having a life purpose is very important. People who have a life purpose prevent the relapse of depression. Also, making other people happy. Learn to make other people happy. When you make other people happy, actually you become happy yourself, and that prevents the relapse of depression. Next thing is giving and receiving compliments. When you give compliments, automatically you will have compliments received yourself. And receiving compliments also keeps you happy and prevents the relapse of depression. Also, having and giving empathy is very important. Be the most empathetic person, be the most kind person, be the nicest person you can be. Uh, I actually have a separate talk on happiness. Please watch that separate talk on happiness on the YouTube channel. Next thing is thinking that every obstacle comes in life is actually a learning lesson, is a stepping stone, is actually a growing phase, and taking every obstacle is a new way of further progressing is very important. Be very resilient, have a high adversity quotient. Next thing is be very analytic and analyze every event, analyze every situation, analyze everything you go through, analyze every relationship, and that will actually prevent the relapse of depression. Next thing is preventing hedonic adaptation. I want you to actually invest into experiences more than material ownership. That means spending money to go out to eat with your friends, particularly with COVID-19, with social distancing and wearing proper masks, taking a vacation once this COVID-19 ends, and experience and investing into experiences instead of material things. Next thing is very important that you should not be comparing yourself to anyone else, either with material ownership or with how good they look or with any kind of thing. Comparison actually makes a lot of unhappiness and has a chance at times to prevent the relapse of depression. Uh, Next thing is learning to cut loss and move on. That means cutting relationship if necessary. If you're in a negative relationship, moving out with cutting with any kind of money or financial loss, leaving any job if job is very stressful. Next thing is becoming very proactive and not reactive. Prevention is the key. That means when it comes down to your health, with your financial health, with relationship, with house, with any kind of ownership you have, including car ownership, being proactive and taking care of those things is very important. Next thing is believing in yourself. Believing in yourself also makes low stress and prevents the relapse of depression. Next thing is something which I've done myself and is doing the character strength online test. This character strength online test is available. You should take that test and know your character strength and practice 8 characters. Try to practice 8 characters every day. Next thing is when you're feeling good, try to flourish yourself. I have a separate video on how to flourish, a separate video on how to be happy, and that will actually prevent the relapse of depression. Uh, Next thing is learning how to think of 5 positive things out of every negative thing. How to think 5 positive things out of every negative thing. For example, if you're stuck in the traffic right now, I think that I can listen to some podcast, I can observe my breath. I know that I'm not in the accident. I can call people, catch up on my social communication, and I can sit and reflect. So when you are stuck in any negative situation, try to see what 5 positive things you can think of. Next thing is trying to not work overtime, particularly if you are suffering from depression. Try to limit your expenses and try to work no more than 40 hours. If possible, cut down your work to 20 to 30 hours if you are suffering from depression and try to invest that time into taking care of yourself. Next thing is keeping your plate 70% full, not overloading yourself with a lot of responsibilities, with a lot of activities, with a lot of unnecessary actions, and that will keep you from preventing the relapse of depression. Again, keeping your plate 70% full and have some downtime. Uh, Next thing is believing that you are here to make difference in this world, making here to difference in your family, difference with your spouse, difference with your kids, and having that confidence that you will make difference has a has a benefit in terms of preventing relapse of depression. Definitely, next thing is downsizing and becoming minimalist. Becoming minimalist lowers your expenses, lowers your stress. You can save a lot of time and resources which you can put into yourself to prevent the relapse of depression. So again, downsize your house, downsize your car, downsize your expenses, and be a minimalist. Uh, Next thing is very important that in between the phases of depression, when you are feeling good, know what are the complications of depression, particularly suicide, health complications, financial complications, sleep complications, relationship complications, and make a plan that when you're going through depression, how you will avoid those complications. Take care of all the medical disease, because many times depression happens when there's an uncontrolled medical illness. That means taking care of diabetes, taking care of heart disease, taking care of high blood pressure, taking care of many other chronic disease. When you take care of the chronic disease, you have a higher chance of preventing relapse of depression. Next thing is thinking that there is no ever a hate for any person, never have a revenge mentality. Having a peace of mind is very important. Next thing is very important, which is to not putting off any important work, prioritizing what is important in life, having a list of what needs to be done on a daily basis, on a weekly basis. So don't put off any important work which needs to be done. When you have an important work not done, it increases stress and increases the relapse of depression, and it triggers the depression. Next thing is having a weekly massage. Massage has shown to cause preventing the relapse of depression. Next thing is if possible having some kind of sauna therapy, either infrared sauna or steam sauna. Those things also have shown to cause prevent the relapse of depression. Next thing is making a list of all the difficult things you have gone through and see how you overcame, how you plan coming out of those difficult things, and reading them at least few times a week and seeing that how you prevail. Um, Next thing is not judging anybody and living a life without any judgment. Next thing is loving people unconditionally. Loving people unconditionally is very important. That prevents the relapse of depression. Next thing is being honest and being truthful. Very important to lower the stress. One lie leads to many lies, so being honest and being truthful is very important. Next thing is try to be the nicest and the kindest person you can be in this world. Appreciate all the kind gestures from everyone and thank them immediately. You should have a mentality of how I can serve more instead of what's in for me. Again, how can I serve more instead of what's in for me? Next thing is learning how to talk less and listen more. Very important if you want to prevent the relapse of depression. Next thing is learning how to not get into arguments and confrontation, becoming very diplomatic, being tactful, and ignoring all unnecessary and not truthful comments about yourself from people. Avoiding what people say about you is very important. Don't take anything personally. It should never bother you what other people think about you. Uh, Next thing is how to resist urge to correct the people. You don't need to correct people non-stop. Give constructive criticism, but not have a habit of correcting people in a constant way. Next thing is find a person who is going through depression and help that person to come out of depression and prevent the depression. That will actually make you stronger, will make you help to prevent the relapse of depression. Uh, Next thing is sharing your feelings with the right person, with a spouse, with a family, or with a friend who can understand you and who can give you positive feedback and uh, positive suggestions. Next thing is watching sunrise 30 minutes in the morning. If you live in an area where there's always a good morning sunrise, try to sit 15 to 30 minutes in the sun with open eyes and watch the sunrise without sunglasses 15 to 30 minutes in the morning. This has shown to cause the prevention of seasonal affective disorder and prevent the relapse of depression. Next thing is reading scriptures. Scriptures means Gita, Bible, Quran, or many of the Jewish scriptures, Buddhist scriptures, reading scriptures because scriptures has typically all the answers we need. So reading scriptures on a regular basis has shown to cause or prevent the relapse of depression. Change job if necessary. If your work is very stressful and if you can change the job, if other jobs are available, see if you can change the job. Next thing is knowing that this depression will pass. This depression will go away because most depression resolve typically with therapy or by itself. So knowing that this shall pass and you have things to celebrate. Next thing is setting intentions to heal. It's very important you set intentions that you will heal yourself. Next thing is when you are going through depression, be as little as possible, as little lonely as possible. Having some kind of company, having some kind of social relation and be as little lonely as possible. Listen to the music you like. It's very important. Uh, like I said, preventing obesity is very important. Preventing chronic disease. You can watch the video on 6 pillars of healthy lifestyle, which I put it on YouTube. Next thing is journaling every day. Like I said earlier, you can watch videos on how to journal every day. I have that video on YouTube also. Uh, Next thing is how to lower the cortisol level. Watch and read my video on how to lower cortisol level. Next thing is preventing negative self-talk. Preventing negative self-talk is also very important. Next thing is be always open-minded. Be always open-minded. Open-minded to all the events. Open-minded to all the people. Next thing is having highest empathy. People who have high empathy have very high chance of preventing the relapse of depression. Also having high compassion, very important. Also having a sympathetic joy, that means feeling happy when other people are happy, very important. Having equanimity, that means not having swings of joy and sorrow, is very important. Always be pleasant, always never have a harsh criticism of others. Learn to tell few jokes, uh, learn to sing few songs. Always dress up, always groom up, shower daily or shower twice a day, shave every day if you are a man, obviously. Uh, Create non-money wealth. That means having a good relation with your spouse, having a good family, having good health, having good friends, having spiritual health. All those things are very important as a non-money or non-material wealth. Having those wealth actually prevents the relapse of depression. Learn to delegate. It's very important that as we are going through depression or as we need to prevent depression, we need to conserve our energy. We need to have resources to invest into ourselves, and that's where delegation becomes very important. Next thing is very important to have a vision statement. You should have a vision statement that if you are not suffering from depression, how your life would look like. You should write down that for me, for example, my vision statement is that when I'm not going through depression, I will exercise every day. I will be the best cardiologist I can. I can be the best lifestyle physician I can. I can be the best husband, best father. Those are my vision statements, and I have those vision statements on my phone. And I try to look at the vision statement at least few times a week, and knowing that this is the way you want to be, and those intentions will actually make you prevent the relapse of depression. Also, next thing is joining a group activity, joining a book club, going out dinner with friends is very important in between the depression episodes. And social connections is very important to prevent the relapse of depression. Next thing is telling yourself every day when you're suffering from depression that this shall pass. And let your friends and family keep repeating, keep reminding yourself that this depression will pass. Let me assure you, let me guarantee you, every depression ends. Your job is to prevent the relapse of depression. Every depression will end either by itself or with the help of medication. So when the depression ends, your job is to prevent the relapse of depression. All the methods I've shown you until now, if you practice most of them, I can assure you, I can guarantee you 90% chance you'll prevent the relapse of depression. Next thing is going to the work every day when you are not feeling depression. When you are feeling through depression, go to work as much as possible. Maintaining routine is very important. That means waking up, showering, shaving, eating breakfast, going to the work, exercising, sleeping on time, socializing, watching happy, healthy shows. All those things and maintaining routine is very important. Next thing is if you're a religious person, talk to your priest, talk to your rabbi, talk to your imam, talk to your pujari. Very important that you get advice and you get counseling from a religious leader also. Next thing is having positive self-talk. Always have positive self-talk. Next thing is not self-medicating. A lot of people treat their depression. Many people treat their anxiety. Many people there treat their bipolar disorder with alcohol, marijuana, sometimes with caffeine when they're feeling down, and many other drugs. Try not to self-medicate yourself. Always have medical supervision and counseling to have proper prescription drugs as necessary. Make sure that you are not suffering from bipolar disorder because many times medication for depression can precipitate mania. Make sure your primary care is aware that if you have any symptoms of mania, symptoms of hypomania. Very important. Next thing is very important. I want you to understand this thing that when you are going through depression, don't make any major decisions. That means not going through divorce, not leaving a job, not selling any stock, not selling your house, not making any major decision. I made a major decision of selling my practice 10 years ago when I was going through depression, and I still feel like that was a wrong decision. Obviously, it turned out to be fine, and I'm still doing well. I have a great job, I have a great career, but at the same time, making any major decision while you're going through depression is a wrong thing to do. Never make any major decision while you're going through depression. Next thing is, if you are suffering from any kind of pain, make sure you control that pain either with proper physical therapy or with proper yoga or with proper pain medications, because when you're suffering from pain, chance of relapse of depression is very high. Next thing is that if you are suffering from depression, sometimes you may need to be on a medication on a chronic base, on a long-term base. Check with your doctor how long you will need the medicine. Sometimes hospitalization is necessary if you are suffering from severe depression. Don't be afraid of it. Hospitals generally are good for you if you are suffering from severe depression, particularly if you are suffering from psychotic depression or severe manic depression. Sometimes electroconvulsive therapy is also necessary. Don't be afraid of it. It's very safe, and a lot of people have received it. Next thing is to know that depression is contagious. When a person is suffering from depression, their spouse, their partner has a very high chance of developing depression. Their kids, their parents have very high chance of developing depression. So if a person is suffering depression, make sure other family members, other relations, other people are not also suffering from depression. Next thing is being in the flow, having a daily activity in between your bouts of depression, which gives you joy, which makes you pass the time very quickly, which where you feel like you are contributing to the society, where you feel like it's your calling, where you are getting actually better, where there is some challenge involved. So being in the flow is very important to prevent the relapse of depression. Even when you are going through depression, going into flow on an everyday basis is very important. Next thing is knowing and talking to your primary care physician that there are certain medications which can cause depression. For example, taking beta blocker type medicine, taking sleeping pills or sleeping medication can cause depression, can cause the relapse of depression. So talk to your primary care medication, what medications can be contributing to depression, and you should be taking off your medication. Uh, Next thing is to note that many times depression can present as dementia, particularly in elderly population. So if you are having memory loss, if you are having difficulty with concentration, if you have difficulty with remembering things, make sure your physician rules out any kind of depression. Next thing is I'm going to give you a sample day, how you can design your day in between your bouts of depression. That means you will have an 8 hour of work, 8 hour of sleep, 1 hour of exercise, 1 hour of meditation, 30 minutes of breathing exercise, 1 hour of eating, 1 hour of cooking and housework, 1 hour of personal time like showering, shaving, other things, 30 minutes of sauna, 30 minutes of reading, 30 minutes of journaling and reflecting, 1 hour of social time every day, and 30 minutes of commute. This is your typical day, Monday to Friday. If you do this thing, I can assure you, you will prevent the relapse of depression. On the weekends, you can spend more time in social activity, more time into self-care, more time into volunteering, more time into housework and hobbies and organizing your life. So you should be investing your resources, investing your time into meaningful activity every day and making depression prevention, depression relapse prevention as your number one priority. I also want you to read some books, invest into reading scriptures, like I said, Bible, Gita, Quran, Old Testaments, Buddhist scriptures, read those scriptures. Watch Wayne Dyer, read Alchemist book, read books from Eckhart Tolle, watch Tony Robbins, watch Sadhguru, read books from Martin Seligman, and definitely, like I asked you earlier, watch Social Dilemma. Social Dilemma is a very important movie to watch. Social media involvement many times can cause a lot of stress, a lot of relapse of depression. So avoid social media no more than 15 minutes per day. I have deleted Facebook from my phone now, so I only go to Facebook 15 minutes per day on my iPad or on my computer. So delete the Facebook from your phone ASAP if you want to prevent the relapse of depression. So again, I've covered today many methods. I've given you a lot of information about how to prevent relapse of depression. You don't have to do all of them. Do as many as you can. Make a list of it. Watch this video again and again. This video will be on YouTube, so you can watch it once a week, twice a week. Particularly if you are suffering from depression, if you want to prevent relapse, watch this video as many times as possible. This is very comprehensive talk. I will be doing this talk twice a month. I will be adding more things as we go, but watch this video as often as possible if you want to prevent the relapse of depression. Share this video. This will be on YouTube. Please have comment. Please have questions. If you are on YouTube, please have comments so I know the quality of video. I know whether you like this kind of content. So make sure you comment on YouTube and comment on Facebook so I know that this content is useful to you. Thank you and have a great afternoon. Thank you.